how is propofol primarily metabolized? What organ does most of the work?
Broad bird's eye overview is that propofol is largely metabolized by the liver, about 60%, and it is processed by the CYP450 system, which if you want to know more about, definitely go check out the lecture in the membership because we just finished the liver lectures. Of note, propofol is also about like 95 to 99%, protein bound, specifically albumin protein bound, which is going to really come into play for our patients with liver disease and liver failure, because patients not only have an increased processing time, but then they also have a decreased production of albumin. And this results in a higher unbound fraction of the drug, which is then more available for uptake. And then it sticks around in the body a lot longer, which is kind of a broad overview way to say it, that a lot of it is processed in the liver, and then liver disease affects the clearance of propofol. We can also talk a little bit about how the distribution half-life and then consequently the duration of action is prolonged for these patients. So again, if you have liver failure, you have altered liver function, you also have decreased production of these plasma proteins like albumin, you're going to then have a longer duration of action, which is going to definitely affect a lot of our patients who are often sick, right? A lot of patients have multi-system disease progression, and some have end-stage liver disease, and that's really going to affect how we choose which medications we choose for our patients.